Hi, we're here today with two very important people on our team. This is Meredith Baker. Meredith is an employee with Carolina Poodle Rescue. She's our medical coordinator. And over here we have Dr. Patrick Mornay, who is with Critter Care Wellness and Rehab, and his beautiful wife Lynn, who's the office manager at Critter Care. And this is our medical team. We'll introduce you to this guy shortly too. First, we're going to go back to Meredith. So Meredith, you are the first line of defense. You are the one that sees them first. You are the one that gets the files together, right? Mm-hmm. So tell me what happens when you get a new dog. What's the first thing that you do?
First, we get their files together so we can see what vaccines they've had, if they've been heartworm tested, treatment for fleas, deworming, fecals, and then we try to look them over and examine them to see what they need. If they need to be spayed, neutered, dentals, or any other special surgeries that they might need.
So Meredith, how many times do you look at a dog and go, something's just not right?
There's been, we've had a few come in that we've done that. Just recently, we had a Shih Tzu come in, and as soon as I got her, she would stop to pee, and there was blood in her urine, and she would just pee a little bit. So she ended up having 13 bladder stones.
So a lot of it is just watching the dogs. You spend a lot of time watching the dogs and using that. You've been in this role almost 2 years, mm-hmm. right? Mm-hmm. And before that, you were a caregiver for 3 years.
3 years, yes.
Correct?
Mm-hmm.
So you take all that experience and that knowledge about dogs, and you turn it into the first line of defense for our medical team. So you're the one that identifies, and then you schedule everything, right?
Yes.
And then
yes.
I know I've seen you putting as many as 15 dogs in a van.
Yes, probably more sometimes, but yes.
Tuesday morning chaos. So you load everybody up on Tuesday morning, and what happens then?
Well, we take them to the vet, and then we usually have probably about 10 exams. Sometimes they're just rechecks, and then we usually do about maybe 4 or 5 surgeries.
Okay, very good. And that's where this gentleman over here on my right comes in, right?
Mm-hmm.
All right, so we're going to flip over here to Dr. Mornay and his beautiful little pup. This is a CPR dog that he adopted, and he's going to tell us about this baby later. But so, Doc, I guess that you've let us keep coming back now for 5 years.
Yep.
We keep showing up every Tuesday at your clinic with a van load of dirty dogs, and actually the dogs are clean.
Yeah.
Outside, inside is different. So tell us about your work with CPR and why you stay with this crazy bunch of people.
Well, you guys are pretty easy to work with, and you've also, there's a great sense of compassion, ethics, where you go beyond what I see in a lot of rescues. You go beyond that, and if a dog needs something that I can't do, like a shunt or something like that, or advanced cardiac issues, urinary tract problems, where they need specialised surgery, well, you guys they go to UGA and they get the necessary help. A lot of these dogs would not, a lot of rescues would not actually go to that extent. What I do a lot of the nuts and bolts stuff, and I like doing it because at my stage in my practice life, I feel as though that I'm giving a little bit back, and I like doing the work. The normal types of things that we see, the most common things, we've seen a lot of bladder stones this year for some reason. And that's, a common history there is that these dogs will be having accidents inside for 2 to 3 months, and sometimes that's the reason why they're surrendered. Heartworm problems, the very common problems in poodles, of course, are dental issues where their dentals are put off because the owners find it too costly to be able to sort of to get the necessary dental done, and of course things get worse. They also, and that mixed with sometimes with adult poodles, they have a little bit of problems with their heart. That's a very common problem that we see. Mammary gland tumours because the dogs are not spayed. is another very common presentation. Old dog spays, which can be not terribly exciting and fairly long, and difficult sometimes, even for me. They can tax you, but overall, I like doing the work, and I feel as though that, you know, the other thing too is that we see is skin disease, awful lot of skin disease, and again that's another reason for surrendering. Heartworm, we often find, and Meredith often, she'll pick up that it is one of the primary tests that they do. They'll do a stool check and heartworm, and a lot of these dogs, heartworm can be extremely expensive to treat. We've devised a way now we can do it reasonably, reasonably economically, and
safely.
and we're not. And again, the problem that you see with heartworm in small breeds is a lot different than it is in large breeds. I mean, we had a big problem with heartworm with this little guy. He had heartworm. He had, when he came in, he was a terror. He was, I think he bit quite a few people in Carolina Poodle Rescue when he first arrived, but he was a bit of a demon. But he had a high level of heartworm. He was anemic from the shearing effect that we get in the heartworm. He had a cable syndrome where the worms are in the right atrium. And we had to end up removing the worms. We had it on video where we removed the worms through the right jugular vein with a long pair of forceps. And he's had myriad health issues other than that. He's got to have a dental about every 6 to 9 months. He's got bad, but he's done amazingly well. He's now negative for heartworm, and he's lost his spleen. He had a severe CNS problem not so long ago that he recovered from, and that's, of course, has got nothing to do with
Most people don't know what CNS is.
But that's
central nervous system problem.
Oh wow.
Yeah, that he recovered from. We thought we were going to lose him, but he fully recovered from that. We think it was some form of pulmonary thrombosis, cerebral thrombosis, possibly associated with the heartworm. He had a very high level of heartworm, this guy.
That's what I was
But
thinking.
he's a wonderful little dog. And
you adopted him.
yeah, we have
No.
now, well,
He adopted him.
that's right,
Adopted
because
Patrick.
because I remember in the cage, all he did when he came in was he was like a little circus dog, jumping up on his back legs when he saw me. So we assumed it was a grey-haired old man that had him, that surrendered him, because he took one look at me and said, "You'll do me."
Cotton is smart. Patrick brought him over to meet me, and he realized that he had to make friends with me. So he started doing his tricks for me. He was like, "Okay, I know what I got to do."
That's
And
a
he's never
CPR
been
dog.
anybody since then. So
Yeah.
But he does bring up a good point. You don't just do spays and neuters and dentals.
no.
You have done everything in the world for us. Treadmill work, plasma injections, removal of things, lots of things.
Yeah.
It's not
He
just,
created a hip socket for Blade, if you
Yes.
remember right.
so, I mean, that's just indicative.
Well, I mean, I've been around a long time, and where I came from in Australia, I was in a very remote area, so it was 3,000 miles to refer a dog. So the buck stayed
we're
with
no
me.
referrals.
So we did, in those days, we ended up doing everything. So I'm reasonably handy in lots of areas, but I know my limitations, and hopefully I do.
We haven't found many. You've given a lot of dogs chances,
Yeah.
and we appreciate that very much. We just really thank you for what you do for us. So, but once Doc deems them healthy and sends them back to us, not all of them go anywhere. So I'm going to go back over here to Meredith. So Meredith, tell us about these two little babies in your arms.
Okay, these are my fosters, and this is Yoshi Grace, and this is Aiden, and both of these guys are diabetics. They both stay with me. They get special diet every day, twice a day, and they both get insulin shots twice a day. Yoshi is great for insulin, and Aiden, he's gotten better. He's gotten a lot nicer, so he's doing better. But Yoshi's also had lots of issues. She's lost an eye. from she has both cataracts, and she lost an eye from glaucoma, and then she's had both ears operated on, resected, where she had just really bad ear infections.
Dr.
And the doc
Mooney's
did
done all
both
of that.
us, yes.
So I think what
Did we do an ablation? On
Yeah.
that?
Yep.
Yeah.
Oh,
sure
I think
did.
we did do
Yeah,
an ablation.
ablation.
Yes, one resection, one ablation.
So what I'm hearing is it's not just about spays, neuters, and vaccines.
No.
It's about a lot more.
Well,
Yeah.
the other thing too we mentioned was we see so many ear problems.
Oh,
and
yeah.
they're in such an advanced stage where a lot of these dogs, they either, you just can't treat them with medication because there's the infection's got into the middle ear, and you've got to do what we call a bullous osteotomy, and we've got to remove the whole ear canal. And what was Chloe the Poodle we did that on? Her ear canals over a period of time. She was a young dog, but she'd been an enormous amount of discomfort for many years, and she took a long while to get turned around with those ears. I think she stayed with us for about 3 weeks, didn't she?
Close to
And
3
she's
months.
Well, it seems
Almost the whole
an
summer.
awful long time. But she's gone to the best home,
Yes.
and she can hear even with
Yes.
the ablation. They can still get some vibrations they pick up, but she suffered through so much that she wasn't little. She was a big girl.
She's a big girl. But that's what it's all about. You said, all about what you do, and what you do is to keep them from pain. We're trying to give them a quality of life, if at all possible.
Well, we're doing a lot of laser treatments because a lot of these older dogs, and that's a source of mystery to me why some of these small dogs end up having horrific disc disease.
I've been talking about that.
Sometimes they need, and laser treatments, we do a lot of laser treatments on these older guys, and it does seem to significantly help them.
Sure does. So we're handling the routines, and then we're handling the not so routines. We've got epileptics, diabetics, paraplegics. We have an epileptic paraplegic.
Yes, we do.
Just to
Smiley.
make things fun.
That's true.
And it's all about giving them quality of life, whether they're going to stay with us forever through our SOS program, or whether we're hopefully going to find someone that will love them. So,
But you know what? I just have to say this. I think one of the reasons that Patrick enjoys working with your organization so much, I've worked with a few other rescues, bird rescue, to lizards, you name it, I've worked in. And it's a pleasure working with you all because you try so hard and you do so much for them. People don't know that all rescues aren't created equal. Some go in and they take what they know that they can adopt that minute. Some go in and take the spays and neuters. I don't know any that go as far as you guys do. And that makes it a pleasure for Patrick, I know.
thank you.
Absolutely.
Well, we're going to keep on trying because we'd like to keep you very busy for a long time. Thanks, you guys, so much. I appreciate your time.